All right, today we're going to do some muscle energy techniques, which is going to call on your muscle to contract a little bit, slightly, a 2 out of 10. And then I'm going to kind of stretch or open up that lumbar spine pain, some lumbar spine area where you're having the pain. So we're going to do this 3 times. I'm going to hold for about 6 seconds. And on the last time, I'm going to hold that stretch for about a 20-second period. I'll ask you to breathe in between each one of the reps. Inhale deeply and exhale deeply just to kind of reset. The indications here are that you're having pain and you're having tightness or limited range of motion. And that's just so happens to be the overall goal is we're trying to increase your range of motion through lengthening those lumbar muscles. You may feel a slight stretch in that lower back, but what you should not feel is any kind of symptoms running down in your leg. If you do, please let me know and we'll stop. Since you have been cleared to do activity, the pars effect is not necessarily a factor here, but that would be a contraindication if you had a fracture that was not healed. So we're going to try to avoid that area. And also if you're having any radicular symptoms or symptoms moving into your leg. So if you want to start by laying face down here and just relax your arms to the side. From here, I'm going to have you do the motion as if you're picking your chest up off of the table. Just activating that. You feel those muscles activated. In that phase, I'm going to push against your lower back area as like this with this force. And each time I'll hold that for about 6 seconds and let off, and you'll completely relax. Okay?
Okay.
Any questions?
No.
If you feel uncomfortable, if you're feeling any symptoms in the lower part of your body, just let me know. Okay, so here we go. We're going to start by activating those muscles. Pick up. 1, 2. And relax. Deep breath and exhale. I'm going to push a little bit. Pressure. And again. A little bit more. Good, right there. And relax. Deep breath. There you go. Applying a little bit more pressure. And one more time. Activate. You go. And big breath. Relax completely. And I'm going to hold that last position there. All right, this next technique we're going to do is a little bit of cupping. Have you ever had cupping done before?
Yes.
Okay. Well, in cupping, I'm going to apply some plastic cups to you. They look like this, and they're going to be applied with a vacuum, and they're going to have a little bit of light pressure. They're going to stay on you for about 8 to 10 minutes, and they're going to help to relieve pain that you're having in your low back area. Some indications for this would be pain, inflammation, and some people even say immune function. Some contraindications for this would be if you had some sort of skin condition in that area, or you had an infection in that area, or you had a bleeding type of disorder where you didn't collide or you have bleeding issues. What you're going to feel is a little bit of pressure, light pressure. You shouldn't feel uncomfortable. If you feel uncomfortable, please let me know and I'll adjust the pressure. Or if you just don't like what's happening, let me know and I'll stop. And the goal here is to decrease your pain. What I want you to think about when you think about cupping is if I was to massage your back, I'm going to press pressure into your back. If we're going to apply cupping, it's going to do the opposite. It's going to pull pressure away from that area. So it's almost like a reverse effect or a vacuum effect, if you will. So if you would find a comfortable position, face down. I'm going to place a towel over your low back area here so that we don't expose or get any of the cocoa butter on you. I'm going to take one of the cups here. You can find the area where you're having the most pain. You just tell me.
Yeah, that's about right.
Right there. Going to work that area. I'm going to place about 4 of these on you. I kind of like to balance it out. both sides. Why not? Just to kind of get that whole low back. And again, if you feel uncomfortable at all, just let me know. We're going to let those sit there for 8 to 10 minutes. Now they've sat for 8 to 10 minutes. I'm going to release these here. The sounds. And we're going to clean you up here. All right, this last technique that we're going to use, since you're having a lot of pain with active range of motion, we're going to do a little bit of passive or positional release technique. And how this is going to work is you're going to be lying face down, and I'm going to find where you have that tightness in your low back. I'll press on that tightness. It may feel uncomfortable, and you'll kind of rate your tightness. That way we have a gauge of where you're starting. So we'll say from a 1 to 10 what that feels like. I'll let you decide when we get there. We're going to move into, I'll move you passively, don't try to help me, into a position that relieves that pain or brings it down to about a 0, close to a 0 or a 1. And we're going to hold that position for about 90 seconds. I'll move you back. Don't try to help me. And we'll see, again, we'll reassess where your pain level is, their tightness level is. So some indications for this are obviously tightness, a decreased range of motion, and that's our goal, is to increase your range of motion and decrease that pain with that muscle tightness associated with that muscle tightness. Some contraindications, since you have been cleared for activity with your pars defect, a fracture obviously would be something that would keep us from doing something like this. But since you're cleared for activity, we're good for that. You may feel a little bit of pain and pressure, not pain, but pressure or discomfort when I'm pressing against, but it shouldn't be painful. And if it is, please let me know. All right, so we're going to first lay face down, and I'm going to find the area where you feel the tightness. Okay. You just tell me. I think I figured it out right there. Okay, so you're going to curl your heels to your butt. Okay, good. Now, from this position, I want you to completely relax as much as you can. I know I'm pressing on that tight area. What would you rate your pain in this area as I'm pressing?
Maybe a 4.
A 4, okay. And that's your scale, the 4. We'll try to see what we can do as we move. Let me know when we get into a position that is near 0.
Okay.
Okay, so completely relaxing. Can I side bend you here?
Oh, yeah, that's pretty good.
Okay, so we found that position of near a 0. You're going to hold that for 90 seconds. When's y'all's next competition?
Not till next week.
Oh, okay, good. Now I'm going to move you back into that position. Don't try to help me here. Okay, relax completely. I'm going to find that area again. Tell me if you feel as tight.
Well, it feels a little bit better.
Okay, what would you rate it?
Oh, maybe a 2.
Okay, and we can continue to do this until you're closer to a 0.
Okay.
And let you kind of go out to practice. So we can repeat this process if we need to. Give you a little bit of a mobilization that you can do on your own in between seeing me next time. This one, I like to call this I don't know, look back at it. I don't know. But if you were a puppy dog, what's your favorite puppy dog?
Oh, the wiener dogs.
You like Dachshunds, all right, for sure. Okay, so you're going to be in a all four position, your hands under your shoulders and your knees under your hips. So if you want to try to go ahead and get in that position. Okay, so the goal here is to kind of keep this side bending motion of your spine, and we're going to do this in a set of this exercise. We're going to do both sides, but specifically focusing on that right side where your issue is. But if you were a little wiener dog and you had a tail, what you're going to do is point your tail that way, and you're going to turn your head and try to look back and side bend, crunch into this space here, and hold that for about 2 seconds, and then come to this side, same way, kick the tail this way, look. Okay, and we're going to keep alternating. We're going to do about 6 of those each side. 2. And on the last one, let's hold that position for about 20 seconds, sorry. That's 3 each side. Try to make sure that we're crunching this. There you go, good. Crunch that space down. Good. Almost feel like a squeeze here. There you go. Last one, hold that for about 20 seconds. Good. And switch to the side. All right, some things to think about when we're doing this exercise is having strong shoulders, hands under those shoulders, those knees stacked under those hips. And I want you to think about your core as well, because our core strength is going to be a really big asset for us to move forward. So thinking about that belly button pulling to that backbone, if you can think about that while you're doing these. But we're going to do these, once to 2 times before, a day before you see me. All right. So one of our biggest goals when we're doing our workout is to increase your core strength and stability. That's what's going to help you, especially as a back spot under that chair stunt, to be able to handle those flyers and to be able to handle your stability of your spine. So with that in mind, a lot of the exercises that we're going to be doing are going to be built around core stabilization or core strength. So we're going to start with one. Here on our exercise ball, you're going to have a seat here. Good stuff. Okay, try to get those feet at about a 90 degree from the hips there. So the way we're going to do this, and we can add layers to it, is we're going to raise your right leg off the ground. If you need to hold the ball to stabilize, you can. Okay, try to bring your knee up higher. Good stuff. Hold about 5 seconds, and then switch. And switch. Is that too easy? Hold your hands out straight in front.
Okay.
Switch. All right, switch. Is that too easy? Raise those arms above your
I think
head.
it's pretty good.
You good there?
Yeah.
Okay. Remember that idea of pulling that belly button to that backbone. Try to keep your tailbone stable there. Okay, switch. Okay, we're going to do 10 of those each side. You keep a count?
Yeah, maybe.
Or are you trying to hold those hands up? If that's a little too difficult, we can put the hands down. You're getting a little
Wobbly.
Yep. Move those arms down. Try to focus on your breathing too. Don't hold your breath.
Okay.
All right. And now we're going to rest, and we're going to do one more set of these.
Okay.
As I stated earlier, a lot of the exercises that we're going to be doing are going to be around getting your core strength and stability under control, but also some functional things, which means movements that you would be doing with your cheer routine. So as you have been cleared to compete, I know y'all use your signs and you are lifting, and you do a lot of stuff on one leg. So we're going to try to do a functional movement, what stabilizes our core as we move this medicine ball around.
Okay.
So you're going to stand on one foot, pick your favorite foot first.
Okay.
And what I want you to do is make sure that you keep your hips level, meaning don't dip one side.
Okay.
I want you to hold the ball out front, stand on the one leg, and try to draw a big circle with that ball. And we're going to draw 3 circles in one direction and then 3 circles in the other direction. And then we're going to switch feet.
Okay.
All right. Remember that belly button. Try to pull that belly button in and try to also focus on breathing. We have a light ball for you right here,
Okay.
a 4-pound ball. You're going to draw circles. Try to stabilize. Try to breathe. Switch directions. If that's a little too easy, we have a disc over there we can add in. If it's a little too tough, we can draw smaller circles or move back to 2 feet. That should be your favorite leg, huh?
Well, it's the left.
Whoops. Recover. And if you want, you can hold it up like Simba at the end. As we stated earlier, a lot of core strength, a lot of functional strength. So here we're building on that functional strength, but we really got to do a good job of keeping our core tight and our control, right? So although this is going to be an explosive movement, which is a functional movement for you in cheer, jumps, tumbles, things of that nature, what our goal here is to build on that explosive movement while maintaining our good core strength, functional movement. Okay. So I want you to make sure you kind of keep control in mind. If we don't have good control, if you feel like it's a little like you're all over the place, we could decrease your weight. We're starting with 15. We're going to do 5 reps per side, and then we're going to rest, and then we're going to do another set. So 2 sets of 10, 5 each side. All right. The motion is this. If you want me to show you here, we're going to go from a good squat position. Be sure that we're supporting our lumbar spine, and we're sucking that belly button to the spine. We're going to reach down, grab that weight. We're going to try to, I'm going to do it slow first. We're going to try to keep it close to the body in one motion and go up overhead. If you want to use this arm for balance, you can. Slow and controlled down. Be sure you're not just dropping it. Take care of those shoulders and squat down to the weight. So,
Okay.
you got that? So real time, it would look like this. And then back down.
Okay.
Yeah, I pick up weights.
Yeah. You put them down too.
And I put them down.
Okay.
Let's do 5 on this side. Nice. Control it down. Try to focus on your breath. Remember that belly button. Good. A little crackle there.
Me.
Be sure that we're not bending over to put that weight down. Good. Squat down and pick it up. Good.
What?
Try to keep that weight close to your body. Almost like you're scratching your chest. Do it. Good. Good. Nice.